Hey, good morning, everyone. Hey, David.
Hi,
Good.
Pedro. How are you?
I'm fine. Thank you. Thank you for your time and the opportunity for you to be here at the APMTC Talks. Our purpose today is to introduce a little bit of your work, and I will try to share with our members and general public your job on INSA, Yamamoto New Scalp Acupuncture. You were a student, a direct student for Dr. Yamamoto, Toshikatsu Yamamoto, and you are a lecturer, international lecturer. You are also a book writer for one amazing book on Yamamoto's that was released, I suppose, in 2020, if I'm not wrong.
Yeah,
Yeah.
yeah.
So, and you are working as you are now at the Tel Aviv hospital, Haifa, I'm sure.
No, Haifa,
Haifa,
Bnei
yeah,
Zion Hospital. Yeah.
yeah. So it's an honor for us to have you here, and the floor is yours. When you're ready, we will be here listening and learning.
Okay, so thank you, Pedro. Thank you all for coming and attending. Excuse all the if there's side noises from the side. I'm just like Pedro mentioned. I'm one of my jobs. I work at the rehabilitational hospital in Israel. I've been doing that for over 13 years, where we have a lot of integration of scalp acupuncture in general, Yamamoto mainly, but also Zhu and Jiao style together in the rehabilitation of the patients. So a lot of times when you're here in the hospital, you can see patients walking around with needles in the scalp and then doing the physiotherapy, doing the occupational therapy, speech therapy. But the idea is that we here it's very integrated and we try and combine all the methods together. This is quite unique, I think, globally, and also unique here in Israel, this type of work in the hospital. It's a government-run hospital. It's not a private hospital, also important to say. And also in my courses, and also what today, I want to bring something from practical and very practical from the personal experience that you can also use in the clinic. So me and Pedro discussed, and we decided that one of the things that might be important to discuss will be a bit of treating Parkinson's, because Parkinson's you can see them sometimes in the rehabilitation, but in the end of the day, in the end of the line, you see them actually in your private clinics. You less see them in the hospitals and less all in specific clinics for Parkinson's. And I started to see that, I don't know, lately also people that have approached me and asked questions how to treat, see more and more people, more of their patients have actually had Parkinson's disease. Now, it's important to say what I'm speaking about is more Parkinson's disease and not secondary Parkinsonism, what's called Parkinsonism. The biggest difference between the two diseases are both movement disorders. One of them is more the Parkinson disease, where you have a certain area of the brain that is getting damaged because you have a lot of protein, Lewy bodies sync on certain receptors that absorb or respond to dopamine. And then slowly, the dopamine is not effective. And those patients, because of the reducement of the receptors that respond to dopamine, they less and less. You have all these Parkinson disease. And then they not only have the movement disorders, but slowly also have cognitive disorders. And it could be cognitive disorders, movement disorders, emotional state disorders, also blood pressure change in loops. But there's a vast effect on the brain, which we speak about what is kind of secondary Parkinson's, what's called as MFM, multifunctional atrophy of the brain, which is also has the physical side of the same as Parkinson's symptoms, but it's more physical movement disorders. They don't have the cognitive degeneration. So we're not going to speak about that. We're going to speak more about Parkinson's disease, and I will give you a point that's very, very useful for treating these disorders. In general, when you come into, from my experience, acupuncture is one part of the puzzle treating Parkinson's patients. Usually it's a multidisciplinary treatment. So it's very important to not only combine, and if you have patients that only doing acupuncture, you have to recommend for them to do also some type of physical exercise or physiotherapy, occupational therapy, speech therapy. Because the more you train the brain in general, the more, even if you have Parkinson or slower in some manner, slower the disease down or the development of the disease. So a lot of researchers have started to show, for example, if you would have Parkinson's disease, even I remember when I was a student about 20 years ago, they spoke to us that once a patient was diagnosed with Parkinson's, then in a period of about 5 years, you'll finish up in a wheelchair. Okay. But slowly, as things have started to show more the patient is active, then actually from 5 years, no, I lost that. Sorry, 5 years can be prolonged to even 15 to 20 years because they activate it. So the idea is to think big, okay, to get them to think big, because if you think about Parkinson's, what happens? They're always being compressed and smaller. The motion, the movement becomes less and less. So even when they do the physiotherapy, occupational therapy, the idea we want to bring into their mind is to think big. Okay? If they think big, if you want, all your motions will be bigger, then the bigness goes to an average size of motion. So one exercise very, very recommended for Parkinson's patients actually is all things that do with balance and dancing and coordination. So I have, for example, a patient, it took them over 7 years, 10 years to diagnose him with Parkinson's disease because he's been doing folk dancing for over 30 years. And even today that he's been diagnosed about 15 years ago, he looks the same, just maybe a bit of problem of the smell or a bit of slow in speech, but actually he looks amazing, okay? And a lot of research shown that even ball dancing actually have a very strong effect on these patients. So what I recommend a lot of times for my patients, okay, we're going to do, let's do acupuncture, but at the same time, I do recommend go do Tai Chi as well. In the Tai Chi, also those movements of turning, the movements that are more curved, turn-ins also have a very strong effect on the brain, especially on the balance. And that's one of the complaints that come into Parkinson's patients, that their balance is interrupted and slowly keep falling. Okay? And if you keep falling, even if that's slow steps that they have, then actually slowly they recruit themselves from social engagement, recruit themselves from the community, and start shrinking down. And then slowly they actually start degenerating more and more and faster. So the idea is to think big and to move big. So even when I think of it, if you think about the idea that you want to, if you go into Chinese medicine thinking, okay, not Yamamoto, but the idea of Chinese medicine, that everything, what happens, it looks like they have a lot of wind, okay, a lot of axis of wind. That's why they have the tremors or the spasm or that slow working. But in that wind, what it causes actually the earth to compress itself, to the earth energy to compress itself. Earth energy is to the center, so it makes it more centerized. And by centerizing this, it makes it more rigid. And in the end, the movements are kind of restricted. And that restriction actually causes them to be in an axis of earth or weakness of earth, somewhere that the earth is unbalanced. And by that constriction, actually, all those tremors start occurring. Think about that. You put in a lot of contracting yourself. So the idea is actually what I found in my practice in the hospital and in my clinic, that what you want to do is get the more movement. So actually, you don't want to cause earth. You want to balance earth out, but you want to actually put movement into that earth, that slow wooden energy, that the coal cycle of wood, not invading, actually, giving kind of a push to the earth. That's what you want to do. So you want to do more motion, more movement. So you want to do a lot of working of liver, a lot of liver points, a lot of Shaoyin points, okay? Sorry, Zhuan points, to get the blood moving, the qi moving all over, and then at the same time do physical exercise. So that's what I found that in my private practice works. And then what I usually do is start combining scalp acupuncture. So I want to share with you a screen. So we'll go through some of the points. So this is actually a point that's very, very useful for Parkinson's. I also want to send you home Like I said, everything here is the edge of the fork, the edge, just touching it. But I want to send you home with a point that you can also try and start using in the clinic. Very, very easy to use. And I'll explain you how to use it. So just like as Pedro mentioned, I'm a student of Dr. Toshikatsu Yamamoto. I was there a couple of seminars I took. I tried to, I was in contact for him up to about a year, 10 years ago, I was still in contact, and just contact just separated. And that's it. And as he mentioned, I also wrote a book about Yamamoto scalp acupuncture. But in my practice, I always try to take the ideas of Yamamoto into the practice of my clinic. So this is actually, I want to show you here a demonstration first of a point. This is called the ZS point. This point was not discovered by Dr. Toshikatsu Yamamoto, but actually by a German physician by the name of Dorothea Zeisus. She discovered these points. It's all the acknowledgement for this point has to go to her. Even when you ask Yamamoto about this point, he mentions that it's not his point, it's her point. So I wanted to show you here a video which shows the activation of the point. So it's actually an 83-year-old patient who has Parkinson's disease. First stage you'll see without the needle in, and then you'll see how he works with the needle in. And we're looking at differences of a few minutes. Okay, so I hope you can see the video. Okay, so this is like this very classical Parkinson walk. See that when he comes to the corridor, he's having difficulty crossing through the corridor. That's called what's called freezing. They freeze in front of corridors. You can see he's trying to cross, holds the corridor, then he has to respond through. Just when we in our courses, I explain how the dopamine works and how it functions in the brain. And this is immediately after. See the difference in more freedom at work, even has more motion in the hands. Well, I enjoyed working with this guy, but after the needle moves the hands around, he's very happy with it. So that's just a demonstration of these amazing effect of the ZS point. So before I go into it, let's show you the location of these points. So we have 2 points of ZS. One is on the yin aspect. Just in general, the yin aspect was the first point that Dorothea Zeisus discovered, and she actually found that it actually regulates estrogen levels, and she has another point which has a dopagenic effect on the yang aspect. Okay, we separate the skull. If we take the apex area and we draw a line between the apex going up to do 20, we actually divide the side into yin anterior and yang posterior. So the yin point, if we have now the most anterior point of the temporalis muscle, what I drew out here, which we have here. From here, this area, you go to about 1 centimeter down, okay, half a centimeter down, and then just palpate backwards till you feel a notch in the frontal temporal region. Okay, that's the ZS yin point, which regulates prolactin. So if I have my hair here, if I have the most anterior part of the temporalis, okay, and then I go slightly down and go back, okay, it's like you can feel a deep area in the temporal region. That's the yin aspect. Okay, so we have, that's the location of the yin aspect. Very, very used to regulates prolactin. But in Parkinson's, what you want to do is also the yin aspect and also the yang aspect. Okay, and in the first stage of the Parkinson's, you want to use contralateral when the disease is only developing on one side. Let's say if it's on my right side, I'll need those points on the left, on my left left side of the scalp. Okay, on the yin and yang, the 2 points. Okay. If it's already developed to both sides, we'll need 4 points, 2 yin and 2 yang points. Okay, so what I want to do here and go more, if I take the mid-forehead line, I draw an imaginary line from the mid-forehead line to do 17. Sorry, this is do 17 in the back here. Okay, and then I'm drawing the hairline, what we can see here in the red. So now I'll be more accurate in the location of the points. So where that mid-forehead line and the anterior hairline meet, sorry, let me change colors. Where it meets there, right here, is the most anterior part on the temporalis muscle. From there, I go about 1 centimeter down, half a centimeter, and about 1 centimeter into the hairline. Okay? And that is the yin aspect of the point. Okay? Now for the yang aspect. what you want to do, if you go now to the posterior area, okay, and you go onto the gallbladder channel. So I'm kind of drawing here what I like to do to make it easier. Actually, what you want to do is divide the ear into thirds. 1, 2. Go to the upper third, or the lower border of the upper third, and go direct line back onto the gallbladder channel. You fall onto the gallbladder channel. Okay, there. Okay. From there, what I want you to do is kind of draw a straight line, 90-degree line up until you meet that mid-forehead line that goes from the mid-forehead, from the most anterior part of the temporalis to do 17. Where it meets there, that's one of your landmarks. Okay, you can even feel there's a big divot there. And then you're going to go behind the ear in about 30-degree angle down behind the ear, hidden behind the ear here. There's a notch. If you feel the mastoid, and you go up of the mastoid, suddenly there's in the upper back part of the ear, there's a notch. And what you want to do from that notch to that point, you want to draw an imaginary line and divide it again into 3 thirds. Okay, and you go to the most posterior upper third. Okay, that is going to put you into the aspect of the yang aspect of the ZS point. Okay, so we have 2 points. Now, also that area of the yang aspect, you'll feel that the tissue there, or the texture that you feel, is kind of puffy, like there's fluids there in that area. That means you're in the correct point. But to make sure you're in the correct point, it also has a diagnostic area. So to really ensure you, so what you don't do, the diagnostic area is actually stomach 12. So for example, I'll go palpate the area of stomach 12 with my finger. Okay, I'm palpating it there. At the same time, I'll palpate where the location of the points. And when the area of stomach 12 reduces in tension of the muscle, I know I'm in the correct point, and I just needle there. That's 1 point. And the same in the posterior aspect, stomach 12 reduces the tension there, and then I needle stomach 12. So that's those points. I could also recommend you, I also have a full video of another explanation. If you want, you can go onto YouTube and write ZS point, YNSA, my name, and you can really locate the point easier. So that's regarding the location of the ZS point, and you can start using it. Now, not everyone responds like this patient. Some patients might take time. Some of them will have a bit of a difference, a slight difference, but they will feel some type of change after the points have been needled. So let's close this. So here you can see also the point. These are epsilon points. They affect the channels, and they points that are very, very useful for affecting the channels. Also, that in our course we cover in full all these, what's called the epsilon, but also we add more information on these points and how they correlate with a certain area of diagnosis of the neck and how they affect the channels. Okay, so sorry about that. So that's about our Parkinson's point. If you have any questions regarding treatment of Parkinson's, just feel free to ask. We'll be coming. We'll be coming. Actually, me and Avi will be coming in March, and we'll be speaking about 3 days of Yamamoto and how to combine it with Zhu, because actually Zhu scalp acupuncture gives another push to the treatment. And I found that sometimes when you start with Zhu and then you add Yamamoto, you're actually maximizing the treatment. And we'll speak more about that in our courses.
Yeah, thank you, David, for your time and for your sharing. And if someone have any questions or wants to know something particular with the Parkinson's, be free to ask. And I will show to everyone that in the 15th of December, David has put himself on the road and help us to have a second APAMTC talks with neck diagnosis in treatment trauma and the polyvagal theory, and it will be at December 15 at 10 a.m. So if you are able to join, then we will share the link, and everything will be available for our members and for Portuguese community.
You'll see that actually all that, what we'll speak about also on the 15th, Also, you'll see that is a strong connection to the polyvagal theory and Parkinson's. So it actually adds more to how to treat Parkinson's as well.
Yeah, and it's important to understand that the degenerative diseases are increasing in all our society, so we have to be able to manage and be more aware that the quality of life of the patient can be improved by several therapies, as you have presented. So, if no one has any question, I will say thank you so much, David, for your time. We
Thank you,
will
Pedro.
meet you then in 15